There are certain syndromes that is highly prevalent in certain society that local folks can identify with local names, and that indigenous coping mechanism to address those phenomena. That's the beauty of CultureBound Syndrome. The political relationship between the United States and China were just opening up. There are 4 physicians from the United States who visited China. Paul Dudley White from Boston, who was President Eisenhower's personal cardiologist, was one of the doctors. E. Gray Diamond and other persons, there were 3 other doctors. But in Boston, when Dr. White visited China and reported on the effect of acupuncture, the practice of acupuncture, there was a big splash in the United States about the use of acupuncture. A lot of the patients started calling him and wanted to find an acupuncturist so that they to treat their problems. Poor Dr. White didn't know what to do about it. So he learned that there was a Chinese-speaking psychiatrist at Tufts. So he referred every case of patients who wants to seek an acupuncturist to me, and to ask me to assist finding him an acupuncturist. I got all of these cases, hundreds of cases of people who was an acupuncturist. I said, you better do something about it. So what happened? I talked to a rheumatologist friend of mine, Lenny Chang. I said, why don't we do a controlled study on the effect of acupuncture? So that was the first article at the New England Journal of Medicine on the controlled study of the effect of acupuncture on osteoarthritic pain. As you know, there are many CultureBound syndromes that have been reported. Simons actually wrote the best book on CultureBound syndrome. So there was Koro, there was Amok, there was Lata, there was Ataque de Nervios, and many other syndromes that had been at the appendix of DSM-IV. The whole idea is that there are certain syndromes, kind of exotic, that is highly prevalent in certain society, that local folks can identify with local names, that found itself expressed in certain ways, and that indigenous coping mechanism to address those phenomena. That's the beauty of CultureBound Syndrome. Among the CultureBound Syndromes, I was interested in Koro, in Amok, and possession syndrome. As you know, Koro is defined as a genital retraction syndrome. It was written over the course of the century when some of the Netherlands psychiatrists visited Indonesia and Sumatra and that area, and found that people were complaining of their penises being retracted into their abdomen and fear of dying as a result of that idea. There were epidemics in Singapore in which hundreds of cases of Koros emerged because of the fear of the people of eating pork that had been contaminated by hormones, and they saw that the penis of the pigs kind of retracted into the abdomen. So they got the idea that they, after eating those porks fed with hormones, they are going to develop genital retraction syndrome. There were no published cases of Koro in the United States until I encountered one case in Boston, the outpatient clinic. This was a referral to me by a primary care doc who was treating this Chinese restaurant patient with complaint of this penis retracting into his abdomen, fear of dying, and developing suicidal ideas as a result of that. He was checked out completely, had physical, laboratory, x-rays, nothing. So he was referred to me as the psychiatrist and see what I can do about it. So mindful of the fact that this is a very unusual phenomena, and having read about Koro, I was very alerted to a possible CultureBound Syndrome. So when I encountered that case, I quickly get him to the clinic. I did a complete physical. I even measured the length of his penis and I make sure that I documented everything, x-rays and everything. Of course, it was negative. So I took a very careful history. It took me 3 years to eventually elicit the full picture, clinical picture of what this guy went through. Because initially he told me, well, I had this problem. I visited a prostitute, and then afterward I tried to masturbate, and then it was okay until one time when I masturbated and my penis kind of became smaller, and then he became panicky, and he thought, well, I had Koro. He was aware of Koro. He was from Hong Kong. Then the people in the community had this idea of Sokyong in Chinese, which is Koro. And they told him, you're one of the 10,000 individuals that developed Sokyong. So that confirmed his fear. So he developed suicidal ideas as a result of that. He thought he was going to die. Over the 3 years, because I treated him, I went to the Conway Library. I dig up all the old literatures about Koro. I understand as much. It was fascinating because in Malaysia, they would have Koro clamp to kind of hold the head of the penis so that it would not retract into the abdomen. So the common people had these ideas of genital retraction. They call Koro. In Cantonese, they call Sokyong. In Mandarin, they call it Suoyang. So they even have terms for that, but it's not in psychiatric nomenclature, and we don't know how to treat about it. Okay, so so after I treated him, he didn't want to talk about his experience, but then later on he frequented the prostitute again and developed that fear again, and he came to me, and that's when I found out that the precipitant of the Koro was a visit to the prostitute, and also that in his early development, in his during his teenage year in Canton, China, he had heard about this Sokyong problem, and he had been warned by his elder not to masturbate, and lest he may develop Sokyong. So he was warned, if you masturbate, your penis is going to retract. That's how he got his ideas of Sokyong. As far as possessions phenomena, there is a very significant historical background to that. In China, I met this guy who wanted to collaborate with me about doing a research project. I thought maybe we should look at possessions phenomena, because in possessions phenomena in traditional Chinese concept, there are terms that describe possessions phenomena in Chinese. Gui Fu, for example, is one of the terms. 中邪, to be kind of struck by certain spirits. Okay. So I thought we ought to look at that phenomena. So we studied 20 cases of people who have been identified by the people who came to the emergency room with spirit possession in China. And so we studied that cases, 20 cases, analyzed the phenomena, and then published it in psychiatric services. It took me 5 years to collect and analyze the data, and at that time the Chinese government was very sensitive to any kind of news item that may portray the country as having mental problems. So it took me another 5 years to smuggle the data out and get it published. 10 years to publish an article on possession syndrome. I spent 33 years in Boston. I was very active in the APA. I was fortunate to be elected speaker of the APA Assembly as of first Asian American psychiatrist. I thank my colleagues about that. And when I get to California, I begin to look at what am I going to do when I retire. I want to move into an area that is close to my heart, my passion, and that's religion and spirituality. It's something very new. People don't know how to deal with it. Some people were adverse to it. Some people don't want to touch about it. Just like what I had been doing in cultural psychiatry in the early 70s. People say, what's the relevance of culture and now spirituality and religion in psychiatric practice? I tell you, it's very important. So my passion now is to systematically look at the issues of religion and spirituality in psychiatry. So I published 2 books from the Christian perspective, from the point of Christianity, looking at the scripture, looking at the Jewish tradition, looking at the Old and New Testaments, and try to see what are the relevant spiritual and religious issues that may be transferable to patient's care and understanding of the religious phenomena. That's what I'm engaged in now. So 2 books I wrote, The Eyes of the Heart, and also more recently, the second textbook on psycho-spirituality entitled Empowered. So what I did is to analyze the psycho-spiritual empowerment of the prophet Daniel of the Old Testament, and from his experience extract 10 lessons, 10 practical lessons backed up by research finding so that it could be applied to our current lives.